Good evening, I'm Eugene Chan and welcome to Straight Talk. Our guest is the Director of Health, Dr. Ronald Lam. Dr. Lam is a specialist in public health medicine and has championed important initiatives, including setting up the new Center for Medical Products Regulations to strengthen regulation and foster medical research. Dr. Lam was the founding director of the World Health Organization Collaborating Center for Traditional Medicine and has represented Hong Kong in global tobacco control and health workforce regulation. Here at home, he also serves in key leadership roles across various statutory boards and health councils. Welcome, Director Ronald.
Hi, Eugene.
Hong Kong has always been very proud to have one of the longest life expectancies in the world, 82.5 for males and 87.9 for females. A really outstanding achievement for Hong Kong people, and I must congratulate the Department of Health. And what factors actually contribute to this trend of a very high life expectancy for the Hong Kong people?
Mm-hmm. Yes, Eugene, indeed, Hong Kong is one of the healthiest places in the world. And as you said, over the past decade, we are seeing a rising trend of the life expectancies at birth, which now is among the best in the world. And attributed to this, most importantly, is our policy commitment that no one should be denied adequate health care because of lack of means, which also means that the citizens of Hong Kong can have accessible as well as affordable health care. Mm-hmm. And as you may also know, we have a very efficient and effective healthcare system as well. And the Bloomberg has just ranked us as the second best in the world as well. Mm-hmm. Added to that, we also have a very strong focus and commitment on the public health, preventive as well as disease control services as well. So on the public health front, we have focused on three strategic areas. One is the health regulation, the other is the disease prevention and control, and the third part is the health promotion and innovation as well.
Right. So, Director, when you say having a long life, I'm sure everybody wants to have long life. I remember all the emperors in the world always looking for the medicine to have a long life. But then long life doesn't mean that you have a healthy life, right? So in your opinion, as your Director of Health perspective, so how healthy are Hong Kong people nowadays in 2025?
Mm-hmm. Apart from we have among one of the best life expectancies at birth, if you look at the age standardized death rate, we are now having a record low age standardized death rate that is 2.5 per 1,000 standard population.
Right.
And this is against the background of a rising aging population. So you can see that how effective and high quality our healthcare system mm-hmm. is. And of this, one of the most important areas is the disease prevention and control. We are seeing that there are several NCDs, non-communicable diseases, that will affect the population at large. And those main causes of death would include those NCDs like cancers, heart diseases, diabetes, and so forth. But all these diseases, they are in a way preventable. Mm-hmm. So if we adopt healthy lifestyles, like have a good balanced diet, right. providing good nutrition for the pregnant women, and also have the regular exercise, as well as avoiding excessive drinking and avoid smoking, then it would help us to have much happier and healthier lifespan. Right. Alluded to this, that the government has put in a lot of initiatives in promoting healthy lifestyle. And as you know, we have a very stringent and also a comprehensive set of tobacco control measures. Mm-hmm. So an indirect indicator that can reflect this is that we have one of the lowest smoking preference in the world, now reaching as low as 9.1% of the population. Mm-hmm. And if we do the healthy lifestyle in the right way, then we can see that the NCDs, especially cancers, the number one killers, would drop significantly. And this is also reflected in right. the significantly lower cancer death rates all these years.
Right, Director, it's very encouraging to hear. I mean, we have a good medical system, we are preventing diseases, I mean, we are doing well. However, you just mentioned a very good point that, as we know, by 2039, 1 in 3 Hong Kong person will be 65 years old or older, that means we're getting a really aging population. Are we, in terms of health, are we ready for the social and healthcare challenges that is sort of coming up? Are we ready?
Yes, we are undergoing the healthcare reform as stipulated in the Chief Executive's policy address. This includes not only the health regulation, but most importantly, disease prevention and control. So that means we are putting a lot of effort and new initiatives, not only in the law amendment related to health, but also the several major public health programs. Let me give you an example.
Right.
Like cancers are #1 killers. We have lung cancer, breast cancers, and so forth. So based on the best available scientific evidence, we have launched a number of territory-wide population-based cancer screening programs to enable us to have early detection and then early identification of the causes and then early treatment for these patients. So an example is the colorectal cancer screening program. And through this colorectal cancer screening program, we are able to achieve identifying several precancerous stage cases that allow us to institute certain treatments, such that adenotomy, removing the colorectal adenoma, and then in such cases, such early intervention can enable us to have early follow-up and then let them to have less fatalities as well.
Right. Director, I'm sure all our viewers will agree prevention is better than cure. We all know that all the time, but in Hong Kong, we always felt that you only couldn't see a doctor when you're actually unwell. I mean, compared to dentistry, it's slightly better. You go there for regular 6-month checkup. So what more can be done to shift the actual focus from hospital treatment to actual prevention and primary healthcare in the community? What are your efforts?
Structurally, right now we have set up a new department under the Health Bureau, that is Primary Care Commission. And so the focus, one of which is have a reform to shift the focus from secondary care to primary care. So to drive on this, from the Department of Health perspective, we have to reinforce mainly 2 initiatives. One is the maternal and child health care, and the second part is to encourage the population, especially those elderly, to use more on the primary care services instead of going to the A&Es or going to the hospitals seeking help. So on the first part, the maternal and child health centers under the Department of Health are the major players in this, because they are providing prenatal care and also immunization programs, as well as child development programs in collaboration with various stakeholders like the hospital authority and other departments as well.
Right.
An example would be the comprehensive childhood immunization program. Because of the high coverage of the vaccine targeting different infectious diseases, we are seeing that previously those diseases like diphtheria, pertussis, and polio has been brought under control, and polio has been eliminated as well. And over the past few years, we are able to achieve through vaccination a total control or elimination of the local transmission of measles and rubella. So these are very shining examples.
Right.
And apart from immunization programs, our maternal and child health or family health as a whole also provide sort of a screening in collaboration with the social welfare sector for those pregnancies at risk and also those families with newborns. We not only identify their health needs, but also if there are any additional social or mental needs, like postnatal depression, like if there are any social needs, we need to refer them to the appropriate organizations to follow up. Let me give you an example. Out of the over 36,000 attendances to the maternal and child health centers, we have found that identified 3,500 postnatal depression cases last year. So this highlighted the effectiveness of the program. And also we have worked closely with the social welfare department, the hospital authority, to institute a child care, comprehensive child care development scheme And through this scheme, we have screened over 6,000 families, and 1/3 of them we identified they got the mental needs that need to be taken care of by the psychiatric departments. So you can see this highlights the necessary intervention at the very early stage of life.
Right, let's have a short break now, and viewers, we will be right back with more Straight Talk. Thank you for staying with us. Dr. Ronald Lam, the Director of Health, is sharing with us the latest statistics on how healthy Hong Kong people are. So, Director, in the first half, you have told us prevention is better than cure, and the Hong Kong medical system is one of the best in the world, and Hong Kong people should be very assured. One area that we must touch on tonight is talking about all these infectious diseases and how prepared we are. We had SARS in some 20-odd years ago, and we just went through COVID-19. And what lessons, when you look back, have we learned from SARS such that we did reasonably well with COVID-19?
After SARS in 2003, we have set up the Center for Health Protection, a dedicated agency to deal with disease infection and also the control of the spread. So we focus on three major areas. One is to have a real-time surveillance. The second is rapid intervention. And the third is responsive risk communication. So these are what we call the 3 R's. And based on the 3 R's, over the past decade, we have developed a very robust disease prevention and control system. So we have instituted various contingency plans, have emergency preparedness with exercise and drills conducted every year on different infectious diseases of public health significance. And so you can see that with such preparedness and response, we're able to deal with, in the past decade, significant outbreaks like the swine flu.
Right.
And so when the COVID hit us in 2020, we are ready, in fact, to adapt the preparedness plans to adopt a cross-disciplinary and also multi-departmental approach to work together against this. And of most important, during the COVID-19, we employed several very important innovative technologies, building up IT systems and so forth to assist us in the responses. So in terms of risk communication, in terms of use of latest technologies, and also the adopting a cross-disciplinary and interdepartmental approach would be of critical importance that we use during the COVID-19 fight.
Right, Director. And one of the things I'm sure all of us remember is we all have to do vaccinations, right? And I'm sure that we all agree that will help to prevent such infectious diseases. So how would you assess the vaccination culture today in Hong Kong, given all that has happened? And one term that has come up most recently is there is sort of a growing challenge as what we call the vaccine hesitancy. So can you address these two issues for the viewers?
Vaccination is a critical, I would say, silver bullet against infectious diseases because it confers not only immunity to those vaccinated, but also because of the herd immunity, it also protect those unvaccinated groups, like those newborns, those immunocompromised as well. So it's very important. But unfortunately, there are some myths and also misunderstanding about the vaccines. People sometimes would be hesitant to take up that because of allergies or other concerns or unknowns. So we tackle that, first of all, by the evidence, because vaccination programs, their effectiveness, their outcomes are very obvious, and over years you can show the effectiveness. Like we are able to reduce the hepatitis carrier status in the population by introducing the hepatitis vaccination program to the newborns. And so to reduce the hesitancy, we also need to rely on the health promotion part as well, to get very transparent our messages. In the COVID era, we try to make the population to adopt the use of COVID vaccine, not only by science, by the clear messages as well. And we are able to promulgate that the different effects and different spectrums of different types of COVID vaccines as a choices for the public to choose. Right. So this is very important.
You are quite happy with the culture that has been developed over the last few years.
Yes, we are seeing an increase in the flu vaccination as well. Right. Compared to last year, the recent season's vaccine coverage has increased by 12%.
Right.
And it is very clear from science and from our health statistics that we have seen the reduction in the severe influenza cases by overall 20% in the pediatric and adult population. So that's very crystal clear that flu vaccination is effective. Right. And this is also reflected in the increase in uptake rate to a new height.
Definitely very encouraging news, that because if more people are sort of protected, the whole community is better in terms of health. Yeah. Maybe we all read in the news recently about those mosquito-borne diseases like the chikungunya fever. I mean, what's the latest now? I mean, do we have to be really concerned because we have a lot of traveling between Hong Kong and other places, especially Guangdong for Hong Kong people, and should we be concerned?
Yes, we have over a dozen chikungunya cases reported last week, and globally there is an upsurge in the chikungunya fever outbreaks. So all these imported cases right now in Hong Kong, they came from different places, right. From Guangdong, from Bangladesh, Sri Lanka, Indonesia, and so forth. So this reflects, first of all, a global warming phenomenon. As you rightly put it, we have increased travel, especially during the summer break, and also the heavy rainfalls and yes. the increase in high temperatures. All this would, predispose an area to the breeding grounds of the vector, because chikungunya is transmitted not from person to person, but through the mosquito vector, which is present in Hong Kong as well, the Aedes albopictus. Right. So to prevent this, we need, on a personal level, not only when going to travel or to outings, you have to put on the insect repellent, wearing dress with long sleeves and so forth, but also remember that in homes or any places, remove the breeding grounds, like small potted plants, and you have to clean those collections of water. Yeah.
Right, so as you just said, Hong Kong as an international hub, I mean, we want more people to come with all these mega events. Mm. How can Hong Kong be the best guard against all this importation of new diseases that we just discussed? Mm. Anything we can do?
Yeah, on the border level, we have the health measures at place, including temperature screening and allowing the travelers to have declarations. So whenever we encounter cases of suspicious with fever, we will have a brief assessment and then refer to hospitals if necessary. So this is from the government's part. From the travelers' perspectives, I would advise they have to take cautious precautions. They have to know the places where they are going to, what's the situation in terms of epidemics. Like if there's outbreaks of dengue fever or other vaccine-preventable disease like measles, then they have to check if they are vaccinated or not. True. To go there and then to put on the mosquito prevention measures as well. And when back from the other places, they have to watch out. Like if you have been to the places with chikungunya case outbreaks, then better you still put on apply the insect repellent for 14 right. days, but to avoid coming back to Hong Kong and then get bitten by the vector mosquito and then lead to a further transmission. So all these measures a host of measures have to pay attention to.
Right. An area, we are covering a lot of areas tonight, Director. One more area I would like to talk about is the role of regulations. I mean, one of the roles of the Department of Health is to regulate healthcare professionals and also the healthcare premises, which is coming very soon in October. Can you share with the viewers, why is it so important to have a regulation of the healthcare workers? I mean, how does that ensure the safety and the quality of care to the patients? How will that happen?
Health regulations are fundamental to an effective and high-quality healthcare system because it guarantees the standard of the professionals as well as the patient safety in the premises. So one part would be the health professionals, because for patients, they are in a disadvantaged position in that they have sort of an information asymmetry because they could not understand if the doctors they are seeing are good or not, the professional competency, whether they are following the ethics properly and so forth. So all the medical practitioners, dentists, and other healthcare professionals, they have to be registered with the medical council, the dental council, or the supplementary medical professional council, and so forth. So this is to ensure that there is a statutory body to give the code of practice for them to follow, and then through the stipulations in the code of practice, they ensure their professional competence are up to standards. And but the sort of health professional regulation is not a one-go exercise. It does not stop that. When you finish the registration, then you let it go. So the professional councils or the government would monitor closely to ensure that they have continuous professional development, learning as a lifelong process as far as they are registered.
Right. One area is about I just mentioned earlier, is about the PHFO, the Private Healthcare Facility Ordinance. How is that going to help the safety of patients? In Hong Kong, we have a dual-track healthcare system. So all the public hospitals and clinics are under the purview of the hospital authority. But for the private sector, we have to ensure the premises where the patients consult their healthcare professionals, they have to be, set up in a very safe and hygienic way in terms of hardware and software for patient safety's sake. So this is why the Private Healthcare Facilities Ordinance comes in. And there are 4 types. One is the private hospitals, then the daycare procedure centers, and the others are clinics and health service establishments. So on a risk-based approach, we have already licensed the private hospitals as well as daycare procedure centers. Now, in October, we will start licensing all the private clinics. We estimate that there are around 5,000 in Hong Kong. Wow.
So starting from October 13 this year until 13th of April next year, we will accept the applications. There are provisions in the ordinance that allow those clinics they have established before November 2018, they have a transitional arrangement, which means that we provide the transitional license to them to allow them to have renovations or changes to their facilities to comply with the code of practice.
Right. Director, we have to leave it there for now, and thank you very much for sharing your insights with us. As Dr. Lam has highlighted, the Department of Health is preparing us for the future with stronger regulation and better innovation so that Hong Kong people can continue to be one of the healthiest in the world. Thank you for joining us on Straight Talk, and have a good evening.